Kidney stones come in all kinds of sizes and shapes and even consistencies. They're the small ones that usually are asymptomatic, not causing any problems. They're only detected when you're doing imaging for something else. You've got some tummy ache for some other issue and it's identified on a CT or an ultrasound. These don't generally need to be treated. Sometimes they will disappear or pass without you knowing. They're the medium-sized stones, generally between 6 millimeters and 1 centimeter. And these can cause pain, especially if they try to move from the kidney down the ureter into the bladder and pass out. If they get stuck, they can cause obstruction and damage to the kidney or infections. These will usually need some kind of intervention, but oftentimes they can be treated medically. Then there are the largest, most complex stones called Staghorn stones. They take up more than one area of the kidney. They can cause tremendous loss of function and structural damage to your kidney. You can have a lot of pain and recurrent infections. These almost always need surgical intervention. The surgery that we would perform for such a stone is called Percutaneous Nephrolithotomy. It's a long word, but the abbreviation is PCNL. What that means is we enter the kidney through the skin, so percutaneous. Make a small hole and enter the kidney and make the hole serially larger until it's big enough for a camera to go down, and then we operate inside the kidney with various energy sources, lasers or ultrasounds or what have you, to break up the entire stone. This kind of surgery, PCNL, reserved for complex Staghorn stones, really requires an expert urologist, someone who is trained and very experienced in complex stone surgery. Preferably someone who's done a fellowship in stone surgery or someone who has many, many years of doing that kind of thing. This is because of the challenges faced during the surgery. Because we're coming from the outside into the kidney, there's the potential for damage to any of the surrounding organs like the colon, the liver, the spleen, the lungs. There is the potential for bleeding. Ideally, you would want to have the entire stone cleared in one sitting, one surgery, which may need multiple entries into the kidney, depending on the complexity. That's not always possible, but that's what we would always aim for. So for all of these reasons, it's best done by someone who does a lot of these. At the end of the day, the overall success rate, meaning how many times out of 100 do we clear all of the stones, ranges between 75 and 85% of the time. That's usually because the stones are so large and complex that a lot of times we can't get everything at one go and we have to come back. It's called the staged PCNL. The main complications of such a surgery would be bleeding, as we mentioned before, damage to surrounding structures, urinary leak after the surgery. There may be leakage of urine outside the kidney, which we need to put a drain in to control. It always stops, but it's just a little bit of an irritation afterwards. Incomplete surgery, and of course, the loss of time from being in hospital and away from work. The advantage of this percutaneous, minimally invasive surgery is we minimize the time away from work, the time away from your loved ones, from your routine, from getting back to exercise. Sometimes this can be done as a day surgery. On average, you would spend 1 to 2 nights in hospital, and then within a week you can be back in your office, back to regular exercise within a few weeks. Certainly up and walking and mobile by the next day after surgery and eating normally. So the recovery period is very short. In this day and age, with everything available to us, this is the one thing that I would recommend for large complex Staghorn stones. What I find most challenging is the first step of the surgery, which is called the entry, getting into the kidney. This is the part that's most fraught with potential for injury to the colon, the liver, the spleen, the lungs. It requires careful planning, so I'll review the CT several times before surgery and internalize it. I will create a roadmap, a 3D roadmap in my head so that I can understand the geometry of the kidney and the stone. Once I'm happy with where I want to enter the kidney, that is the place that will give me the maximum chance at success at clearing as much stone burden as I can while minimizing my risk of complications. Once I've chosen that, the next step is to put a needle into the kidney using the ultrasound or X-ray. And once we're in the kidney, we will make a tract that gets bigger and bigger. Initially, it's just as wide as a needle, and then eventually it's roughly about 8 millimeters wide. Once it's big enough for a camera to go in, then we'll put a camera into the kidney and take a look around, and we'll get to visualize the stone and start breaking it. It's particularly difficult with Staghorn stones because sometimes there's no space to get into the kidney. The stone just abuts the wall of the kidney. So we've got to employ different tricks and tips to get in and start our work. How we gauge success really is very variable. It depends on what you set out to achieve. Ideally, it's complete stone clearance, that is getting all the stone in the kidney at one go. That sometimes is not realistic nor safe. So for example, if there is an elderly, frail patient for whom prolonged surgery and anesthesia would cause more complications than leaving some stones in areas where it wouldn't bother them, that might be success. They may have had a stone that was blocking the kidney and causing pain or infections or continued damage. So just by removing the part that's obstructing and letting them continue with smaller fragments that they could manage and live with would be a safe thing to do. Sometimes the stone burden is just so great that you couldn't possibly get everything in one go. Again, because prolonged anesthesia causes a risk to the patient. So for me, success is achieving what you set about to achieve. It's really important that you have your goals and boundaries at the beginning, and you know when enough is enough and to call it a day. But as I mentioned before, roughly 85% of patients end up with complete stone clearance at the end of a PCNL. So altogether, for these complex stones, it is the most efficient and safest way of surgery. And most patients have a better quality of life after PCNL.